The Nipah virus was first discovered in 1999 during an outbreak among pig farmers in Malaysia and Singapore. It was initially detected in the village of Sungai Nipah in Malaysia, which is where the virus gets its name. The outbreak was primarily associated with pig farms and resulted in both severe disease in humans and substantial economic impact due to the culling of pigs to control the outbreak. The Nipah virus can be transmitted to humans through several routes. The primary mode of infection involves direct contact with the natural hosts, which are fruit bats of the family Pteropodidae, particularly species belonging to the genus Pteropus. Humans can become infected when they come into contact with the saliva, urine, feces, or other body fluids of these infected bats. Another route of transmission is the consumption of food products that have been contaminated by infected bats. This typically involves raw date palm sap or fruits that bats have come into contact with, either through their saliva or droppings. The virus is also known to spread from person to person, a mode of transmission observed in several outbreaks. This human-to-human transmission occurs through close contact with the bodily fluids of infected individuals, making it a concern particularly in household or healthcare settings. Additionally, in earlier outbreaks, such as those seen in Malaysia and Singapore, pigs served as intermediate hosts for the virus. Humans contracted the virus through close contact with infected pigs, primarily via the animal's bodily fluids. This zoonotic link highlights the importance of monitoring domestic animals in regions where the virus is present. The symptoms of Nipah virus infection can range from no symptoms at all to severe and potentially fatal outcomes. Initially, individuals infected with the Nipah virus may experience general signs of illness such as fever, headaches, muscle pain, sore throat, and vomiting. These symptoms can be mistaken for those of many other viral infections, which makes early diagnosis challenging. As the disease progresses, respiratory symptoms can develop, including a cough and difficulty breathing. In more severe cases, the infection can lead to acute respiratory syndrome, a serious condition requiring immediate medical attention. The most alarming manifestations of Nipah virus infection involve the neurological system. Patients may experience dizziness and drowsiness, which can escalate to more severe complications such as altered consciousness, neurological signs indicative of acute encephalitis, and seizures. In extreme cases, the condition can deteriorate rapidly, leading to a coma within 24–48 hours of symptom onset. Given the virus's impact on the central nervous system and the respiratory system, Nipah virus infections can be particularly deadly. The incubation period, the time from exposure to the onset of symptoms, typically ranges from 4 to 14 days, but it can extend up to 45 days. Due to the potential severity of the symptoms and the high mortality rate associated with the infection, which has varied from 40% to 75% in past outbreaks, urgent medical care is critical to managing severe cases effectively. Currently, there is no specific treatment or vaccine available for Nipah virus infection, so medical care primarily focuses on supportive measures to manage symptoms and complications. Patients with severe cases often require hospitalization, where they receive intensive care to maintain hydration and oxygen saturation. Ventilatory support may be necessary if patients experience significant respiratory difficulties. Treatment also includes the administration of medications to alleviate specific symptoms such as fever reducers and pain relievers for body aches, along with anticonvulsants for those experiencing seizures. Close monitoring is crucial, especially for patients showing severe respiratory and neurological symptoms, to manage complications like encephalitis and respiratory distress and prevent long-term damage or fatality. In some cases, antiviral drugs like ribavirin have been used experimentally, although their effectiveness against the Nipah virus is still not well established. The research community continues to investigate several antivirals that might be effective against the virus. To prevent the spread of the virus, patients are isolated from others and treated by healthcare workers who follow strict infection control procedures. Prevention strategies also include avoiding contact with bats and sick pigs, ensuring that food and drink are not contaminated by bats, and avoiding consumption of raw palm sap. During outbreaks, raising community awareness and enhancing surveillance are key strategies to control the spread of the virus.